With this, let me also take you through about the medications, how to put the eye drops, the technique to put the eye drops, and how to use them. Before that, the kit that we give you will have two types of eye wipes which we give you. One is a dry wipe and another is a wet wipe. After explaining to you how the eye drops have to be put, I'll explain to you how the two wipes also can be used. I know how the eye drops are applied into the eye. There may be between 3 to 4 different type of eye drops which we give you. The eye drop has to be removed from its inner casing. Normally it is sealed at this level, so you have to apply some force for it to be opened. Once it is opened forcibly, it makes a sound. Then there is a ring in quite a few of the eye drops. This ring has to be taken off and discarded. Some of the eye drop bottles may have a pre-placed piercing in the opening on the tip of the bottle. Some of them may not have it. If the bottle has a pre-pierced opening, then you don't need to do anything. Like in this case, this piercing is already done. So as soon as I put the drop, the eye drop comes out. In some of the bottles, this pre-pierced opening may not be there. In such situations, a piercing is available in the cap of the bottle. All you need to do is replace the cap back after you have removed the encircling ring there, and then tighten this bottle. If you tighten this bottle well, the cap will pierce by itself and create an opening on the tip of the bottle. In some, then you can test whether it is opened or not by dropping one drop of the eye drop and then checking it out. In some situations, despite you doing or tightening the cap, the piercing may not still open because the piercing in the cap is not very sharp. In such cases, we advise you strongly against using any office pins or any other kind of sharp things which are available with you or in the kitchen. We advise you to come give the bottle back to the hospital so that we can give you a replacement. However, in emergency situations where you are forced to use this bottle and it is not opening, in such exceptional situations, we advise you to take these needles which are available in the pharmacies, which are sterilized. You can open these needles which are sterilized, and with this sterilized needles, you can gently make a piercing within the bottle. But as I said, keep this only in exceptional situations and not as a routine. You have opened the eye drop bottle. You can ask the patient to look up like this and then come close to the eye. With one hand, you have to put the eye drop in the eye which has been operated. So if this eye of the patient has been operated, the left eye, you can use one hand to pull down the lower lid gently, and without touching the eye drop tip to the eye, from a short distance, apply a gentle pressure so that one drop gets into the eye in this place, and then leave the lid and ask the patient to close the eyelids for about 10 or 20 seconds. As part of the post-operative kit, you are given two kinds of wipes. To make the understanding easier, one is a red wipe, the other is a blue colored wipe. The red colored wipe is a dry wipe. That means there are tissues within that which are dry. The second is a wet wipe which is moistened. How do we use these dry and wet wipes? Let me demonstrate it to you. Well, again, this is, as I already said, this is a dry wipe and this is a wet wipe. Now, once we put the eye drop within the eye, as soon as the eye drop is put, a good part of the eye drop will actually flow out of the eye. This area needs to be dried up. Use a scissor to open up the wipe. This is a sterilized wipe. So all the procedures that I am demonstrating it to you have to be done after washing your hand meticulously with soap and water. Once you have done this, you can take out the sterilized wipe, gently put it around your finger like this, and gently dab the eye this way. Whatever excess eye drop that was coming out of the eye will get absorbed by the dry tissue. Let me also demonstrate to you how we use the wet wipes. So once you have put the eye drops, sometimes there can be a crusting at the corner of the eye. So it can be a white crusting over here or a yellowish crusting or some discharge along the margins of the eyelid. Dry wipes will not be effective in removing this crusting. This is where the wet wipes come into play. So you cut off the tip and then extract the wet wipe. You can see that the wet wipe is sticking here. In the same way that I demonstrated it to you for the dry wipe, you can either roll it around your finger like this, which is easier, and then do a smooth wipe along the lid margins. Make sure you do not use force when you do this, and a light wipe like that should be able to clean up the lid. In case the crusting is quite high and you need to go closer, in that case you can pull up the upper lid and ask the patient to look down. Can you look down please? With this, with a gentle wipe, you're clear of the black area of the eye and you can gently wipe the lid like this. Similarly for the lower lid, look up please. You can pull the lower lid, ask the patient to look up and wipe the bottom of the eye like this. This is the method to use the dry wipes and the wet wipes.